We mentioned it there. You went into number 10 and you spoke to the Prime Ministers, among others, about the state of the NHS. I think you can see the picture of you standing on the gates of Downing Street. How was the meeting?
So we're really pleased that it's been acknowledged at the highest level, and it's pleased that we recognise there's a crisis, because there is a crisis in emergency medicine. We know, and this crisis is much worse. You know, every winter we seem to go through this thing. There's another A&E crisis, but it's important to recognise that what's going on at the moment is much worse. And the graphs that you were putting up beforehand showed that. Yeah. And the visible markers are ambulances waiting outside hospitals. But that is only a visible marker of the whole system being under stress. And what we're seeing is, if you go into the emergency department, you'll see that people are being looked after in inappropriate areas with long waits to be admitted. And if you go onto the wards, they're full. And fundamentally, the big problem we've got is, as you showed, that we don't have enough beds. Our hospitals are too full for us to do the jobs that we need them to do.
It's interesting, because you mentioned there about how, look, we talk about winter crises all the time, but this is different. And I have to say, you know, I've been doing this job for some years. I've spoken to a lot of people working in the health service at this time, and it feels quite different now. I mean, frankly, you know, you guys seem quite frightened. Is that true?
Yes. I mean, it's important that people realise that if they think they need to seek help, they do seek help. And one of the anxieties that we have about all the frost that's going on at the moment is that people who are will sit at home when really they should be seeking help. That's really important. But at the same time, pretty much everyone I spoke to, they will say, I've never seen it as bad as this.
Not even during the height of the COVID pandemic?
So in a very, very different way. Yes, COVID was an extraordinary time, but all sorts of things went over it. This feels worse because there's so many bit strands to it, and it's so difficult. And the long waits that we've got are what are so dangerous and what we're so worried about.
I mean, I guess the biggest thing people worry about is safety, about lives, right? And you believe that lives are being lost because of delays?
It's not just belief. So there's some scientific evidence to back us up with papers that have been published in scientific journals. Everybody who's looked at this has always found that when you start getting long waits in emergency departments, you see an increase in mortality. So there's reasonable scientific data to support this. But not only that, we've also got separate analyses where people have looked at ONS data and have suggested that the increase that we've seen in excess mortality through this year, and there will be lots of factors at play, it's not one single thing, but there will be lots of factors, it's entirely plausible. And it shows this. So we think that problems accessing urgent and emergency care, whether calling an ambulance, waiting a long time for that, being anxious about going to hospital, or the long waits in emergency departments, will be contributing to about a third or a quarter of all this excess mortality.
And you believe that's 300 to 500 people a week?
Yeah, I mean, it will vary. But in a way, actually, the number doesn't matter.
No.
You know, it's actually about what we do about it.
Yeah.
And it shows that there's a problem that needs fixing.
OK, and just before we get on to what we should do, because I am very keen to get your view on that, you know, when you talk to ministers and the government, they talk about COVID an awful lot, and they say, look, this is because of COVID, because the pressures we had during COVID, because of people delaying, you know, getting appointments, etc. Is that true, or do these problems go back longer?
Oh, the problems go back way longer. You know, if you look at performance indicators of where we've been having problems, COVID absolutely is yet an additional thing, and it's taking a lot of disruption onto hospitals. But the problems that were causing this go back 2015. You know, we knew that this was a problem before. But if you go back before 2015, we did not have problems with ambulance handover delays. We did not have very often people spending more than 12 hours in emergency departments.
And is that underinvestment?
So it's a variety of things. Fundamentally, the big problem is that our hospitals are too full. And you put up that graph of not having enough beds, but also we're not using those beds properly. And actually, in terms of what we do with our beds, we need to make sure we're using those beds absolutely as efficiently and properly as possible.
Which I know part of that, of course, is social care. Keir Starmer also talks on the programme today about using more capacity in the private sector. Do you think that's a good idea? I
think we're in a state of crisis at the moment, and anything we can do to reduce occupancy within hospitals is the right thing to do. It feels like an expensive way to try and get ourselves out of a pickle, and I think long term we've got to look at how we actually stop this happening again. And that means actually getting to probably a more cost-effective way to try and do this by reforming the way we do social care in this country.
I'm interested to know your thoughts on what needs to happen in the short term, but also in the long term. What do you think needs to be done?
So
And it's a big question, so apologies.
A single answer isn't going to cover everything.
Sure.
But fundamentally, the thing we need to do is reduce the occupancy in our hospitals, and that means having more hospital beds and using those beds better. So fundamentally, that's the big problem. That requires investment. That means also it's not just beds, but it's the workforce to look after them, and we do need to expand our workforce. And that's right across the patch.
The government did announce more money for the NHS in November. Maria Caulfield was talking about that, an extra £3.3 billion in each of the next 2 years. And I guess some would argue that, it's not just about money, it's not just about putting more and more money into the NHS, it's about reform too, otherwise the money effectively is wasted. Do you think that's true? Or?
I think that's fair. I mean, the NHS is an enormous organisation, and there are always things that we can do differently and think innovatively about how we do this. And I think that's a fair challenge that we need to do it. But repairing something that's broken costs a lot of money.
So more money is part of the issue, but reform too?
Yes, but you're dealing with something that's fundamentally just very, very fragile and broken, and that takes a lot of work. And, short-term big payments to try and buy aren't the way to do it. We actually need sustained, predictable funding so we can use that well, rather than and that means things like capital funding and actually building capacity, not just on short-term salary fixes.
And just looking forward, I know you don't want to talk directly about strikes, which I understand. There are meetings going on tomorrow. Are strikes also having an impact on the safe running of the NHS?
Well, we need to have a sense of perspective. We've been in trouble for the last year. We had 3 strike days in December. We're only having 4 strike days. Yes, they're disruptive. Yes, they're difficult. But you've got a much bigger picture of terrible working conditions that have been going on before.